rat race 7. A structure that is having a bag-like configuration. So, opened bag-like structure, which is the stomach. I am seeing a punched out ulcer measuring 2 centimeters in diameter or less. The edges are straight. Edges means what we are seeing straight. The floor is clean. This is the floor due to constant acid digestion. The surrounding mucous folds, look at these. These are the mucous folds that are contracted towards it in a flower-like fashion or stellate due to fibrosis. The diagnosis is peptic ulcer stomach. Bag-like structure, remember. Again, a bag-like structure, and compare it with this one. There is a large ulceroproliferative lesion in this case. It is a bag-like structure, therefore the stomach. The lesion measures dash into dash centimeters. It is gray-brown with areas of hemorrhage and necrosis. The edges can be slightly everted. The floor is dirty due to necrosis. The diagnosis is gastric cancer. Compare it with the peptic ulcer. Another specimen, a bag-like structure but more rigid or stiff, leather bottle-like. Look at the picture over here. The walls are uniformly thickened, and you will have to mention the measurement of the walls. The mucosal folds are lost over here. The diagnosis is Lionitis plastica or carcinoma of the stomach. Here again, it is a wide and a collapsing tube-like structure from now onwards. A segment of the intestine measuring dash centimeters long. This is a concept of the large intestine and the small intestine. The external surface is grayish pink. If you observe carefully, you might see minute nodules. The mucosal surface shows gray-white ulcers, which are perpendicular to the long axis. This is an ulcer which is perpendicular to the long axis. This causes a narrowing and the lumen is constricted. The diagnosis is tuberculosis of the intestine. Another specimen, gray-white, is again a theme, large intestine, small intestine. I am finding multiple ovoid ulcers, which are having the long axis parallel to the long axis of the bowel, overlying the Peyer's patches. The floor is grayish-black due to necrosis. This is a schematic picture which you can remember. The diagnosis is typhoid ulcer of the small intestine. Again, you find that there is a gray-white tube. You'll have to remember it. There is multiple button-like elevations which can be seen, and actually they'll be having small ulcers. They have a narrow neck and they have got a wide base. This is the case of amoebic ulcer. Look at the narrow opening and a flask-shaped ulcer, classical of amoebiasis. And this is the trophozoite, the cyst, and the pre-cystic stage of the entamoeba histolytica.